We're about to go live.
Okay.
All right?
Will someone cue me?
Mike is gonna give you a countdown.
Okay.
From 5 with his fingers, right?
Okay. Okay.
Okay.
Looking at this camera, Mike. Right?
Mm-hmm.
Yeah.
This is the closest to being at the dentist.
Tell me what. 4, 3, 2.
Hello everyone, I'm Priyanka Pruthi, Senior Producer at Unicef, and I'm here with my colleague Dr. Carlos Navarro, Principal Advisor for Public Health Emergencies at the organization. We are coming to you live from the Unicef headquarters in New York City to talk about the coronavirus outbreak that has caused so much nervousness, anxiety, and panic as it spreads rapidly across the world. We know there's a lot of information out there, and at this point it's probably getting hard for you to tell what's fact or fiction. So Dr. Carlos is here to set the record straight and answer all your burning questions about coronavirus. So write into us in the comment section below, and we will take as many questions as we can. Thank you so much for being with us today, Dr. Carlos.
Thank you, Priyanka.
So many questions I have of my own. I want to first start with the very basics, which is, let's just get this information out, the facts out about just how the virus is transmitted. Can I breathe it in when someone is coughing or sneezing around me, or is it only by touching surfaces? It would be great for us just to start with that, the transmission.
Of course. The virus transmits through the droplets, the little drops that we produce when we sneeze, when we cough, or sometimes even when we speak. So it does not travel in the air. It's always in these drops. So it can be directly, and you will acquire it through when you touch your ears, or your nose, or your mouth, or if you put your hand somewhere with the hand being soiled with those droplets. That's why we recommend the washing hands and the washing all the surfaces, and then keeping people, keeping some distance if possible with people. Those droplets only travel about 1 meter.
And I know we're talking a lot about social distancing, which has become sort of part of our everyday vocabulary right now. Just to give everyone watching an idea, we're right now, are we too close?
We're about the right distance.
Is this the right distance? It's basically right here. This is how much we need to be away from each other at all times, essentially. So with the social distance in mind, is there anything else, especially with children, other than the distance? Are there other precautions that you suggest we could take that are critical at this point?
Well, in order to reduce the transmission of the virus, we're recommending a lot of measures together with the World Health Organization, WHO, and the governments to reduce the transmission of the virus. So making a small difference between what we're doing to protect ourselves and our families as individuals and as families, everything we're doing to reduce the transmission around. So here in the city of New York, authorities are recommending that people work from home, that people go to work in different days, and this will reduce the amount of people that is traveling on the metro, on the subway, the amount of people that is at the same place at the same time. That reduces the transmission of the virus. As you may have heard, the expression is being used is to flatten the curve, so that the outbreak will not have a very big peak that will overwhelm all the systems and will transmit very fast, but to have a smoother transmission with less people being affected. So that's one way to protect others, because by doing that you are making it less likely that other people, and particularly those people who may present complications, and as we know this very well by now, it's elderly people, people with a chronic condition, mostly respiratory or cardiovascular or others, who are the ones who really have a risk to present a severe disease, and in some cases to even die. So by doing that, you're protecting others. And then there's a number of things that you do to protect yourself and your family. And as we said, it's all the hand washing, all the cleaning, all the actually things like just keeping, now with the better weather coming in New York, keeping the windows open to circulate air. All these things will help protect your children, your family, and yourself.
Okay, so air ventilation, very, very important. Can you also, Dr. Carlos, talk a little bit about, everyone's in the rush to buy hand sanitizers right now. Any specific kind of disinfectant or hand sanitizers that we should look out for, or is soap and water the best? As there's a scramble for products out there. What exactly, if you could tell everyone?
Hand sanitizers, that, provided it's 60% alcohol, that's the minimum. It is definitely very effective. More effective than hand sanitizer is regular soap. And normally soap we can find everywhere. We haven't heard of soap being out of stock, with maybe one exception. And is using it frequently. And then when you wash your hands, it's doing it, usually say 20 seconds. So being thorough about washing that. It gets us an attitude. I think we all can get into that attitude very easily. It becomes a routine to do that. And well, I also recommend to create those routines. So we have the routine of washing our teeth in the morning, or washing our hands, and then let's say when you get out of the house, wash your hands. When you get in the office, wash your hands. I'm asking my team here, when you move from one floor to the other, stop in the bathroom, wash your hands. It becomes a routine. It's not a big effort. And that's the way you're protecting yourself and your colleagues and your families and your friends.
So washing hands frequently and regularly. As we talk about precautions and things that we can do, soap and water, you said, is the best. No, there's a lot of questions about the use of masks and whether we should all be wearing masks. So when is it important to cover your face, or who should be covering their face at what time? If you could just talk to our viewers a little bit about that.
We recommend the use of masks first of all to health workers, and they know how to use them, and they know the specific times they need to use them, and in particular when they're examining a patient that has symptoms and they may need to perform a procedure inside the mouth or on the throat of a patient, and those definitely need to use a very specific kind of masks. For the general population, for ourselves, the mask is useful when you are the one who have symptoms, who are coughing mostly, in order to protect others. If you don't have symptoms, the mask, it definitely filters the virus, but it may become a problem itself. If you're touching the mask, the outside of the mask, maybe it may itself be soiled with virus. So if you touch it when you're removing it, or if you're then touching your face, etc., you're actually making it more problematic. It may actually increase the risk that you are inoculating the virus on you. It gets worse because of the very high price of the masks in some places. As the price has been going up, people would like, logically, to keep the same mask for the whole day, and that's definitely not a good idea. If you can avoid that, it's better not to use the mask than to have the same mask the whole day, because at the end of the day it may be soiled and it may be a source of infection. Those are disposable masks, so if you're coughing, if you're exposed, if you're being close to a patient or someone having symptoms, then you should remove it carefully, not touching it, dispose of it and wash your hands. But with the price of the mask at this time, we understand most people will not want to change the mask so many times per day. So that's one of the reasons, that's the main reason why we do not recommend the use of masks unless you have symptoms yourself to protect people around you or you're a health worker.
Okay, so I'm gonna summarize that real quick for everyone joining now. What Dr. Carlos said about the use of masks was that they recommend the use of masks if you are showing symptoms yourself. And of course, if you're a health worker or medical professional, but if you're not showing any symptoms, it is not necessary to wear a mask. I think that's an important point. I have so many more questions, but I'm going to pause for a second because a lot of people watching us sending us questions. Thank you for that. Keep sending them our way. I'm going to start with a question we've received from Flori Brangla, and her question is corona actually that dangerous, or coronavirus actually that dangerous? How dangerous is it, I suppose, especially now, as it's now a pandemic, so people are worried. How concerned should we be?
I will start with that, and thank you, Flori, for your question. The fact that it's now being described as a pandemic does not mean that it's more serious or more dangerous than it was before it was called a pandemic. It simply states what we already knew, that right now we can find the virus, and when there's people getting contagious with the virus in every continent. This is all it means. So it doesn't mean that the situation is worse. We know the virus to be quite severe in the specific groups that I mentioned, so the elderly, people with chronic respiratory or cardiovascular conditions, and those are the ones that we need to protect. All of us need to make sure that they can be protected and they can get healthcare and they can get better. For other groups, particularly young people and more in particular children, we have not seen the big severity, and we're not seeing a lot of contagion or a lot of symptoms. Now, as a population as a whole, we are at the earliest stages. We need to acknowledge as well, we're at the earliest stages of an outbreak, except in China, where it seems to be coming down. So how serious it is in terms of how many people are going to get affected, that is something that we don't know yet. We know from China that the measures they taken seem to be quite effective, and the majority of the population did not get infected. But this is something that we're still learning, and we will learn in the coming weeks. We're going to learn a lot about the actual spread of the outbreak, and therefore about how severe it is. So stay tuned.
Okay, and I'm getting a lot of questions for you. I have another one from Vishali Mehra. Vishali Mehra has asked, is there a vaccination available for coronavirus? I know that's also a question on a lot of people are asking. I'm going to request you to look at this camera and address that to the audience so they know.
There's not. There's no vaccine for coronavirus available yet. Normally it takes many years to develop a vaccine. This is a new virus, and we've only known about it for almost 3 months now, so it's too early for a vaccine. But there are more than 10 vaccine candidates, more than 10 groups who are researching based on vaccines that existed before. And there are several trials going on, particularly in Southeast Asia and other parts of the world. We think that in a best case scenario, if one of them is a successful vaccine, is an effective vaccine, we will start seeing a vaccine that is approved and is available in about 1 year. And then to make it available to all the populations across the globe, of course, it will need to take a little longer, the time it is produced, the time it is manufactured and distributed. That would be one of the fastest development of vaccines in history.
Wow.
Similar perhaps to what we, with WHO, with other organizations, did for Ebola in the last years, that a vaccine was developed at that thing. So there is several promising vaccines that are being tested, but as of now, none of them is available. But let me, Priyanka, take advantage and say, like, it's a very good question, because
yes.
vaccine is definitely the best thing that we could have to prevent outbreaks. And we do still have seasonal influenza, the flu. It's still circulating. So it's a very good reminder for those who are not vaccinated for influenza, for the flu, to do so. And for many other diseases that can be prevented through vaccination, and like measles, for example, which is unfortunately out of hand in a number of countries, whereas we have a vaccine, and unfortunately is not being used at the level that it should to stop measles outbreak from happening across the world. So, great question, and praise to all those who are working really hard to develop the vaccine also for coronavirus.
Great. So that's an important takeaway for everyone out there wishing, wasn't there a coronavirus vaccine already available? Remember, there are many vaccines available for other deadly diseases, and so definitely all you parents out there, vaccinate your children. Talking about parents and vaccinations, Can we talk a little bit about the impact that coronavirus has on children? You talked about vulnerable groups, but if you could just elaborate a little bit on whether or not children are at risk and what age groups specifically would that be?
Well, we do know that children get the infection less often, and we do know that the symptoms are lighter. You still have the same thing with the possibility of complications for those who have an underlying disease, and that's why we need to do everything to protect and to reduce the spread, to protect the children as well. There's a lot we don't know, and once again, in the coming weeks we're going to be learning more and more as more researchers and countries are sharing their information. But we do know, we're confirming, this is very recent evidence, and stating a little bit, there's evidence that they are not driving the outbreak. It means that they can transmit the disease, but it's not the main means for transmission. It's not children. Most children that have gotten infected is through contamination from family members, mostly, rather than schools, etc. Now again, we are working with many research groups, with the World Health Organization, with many governments, to increase the information we have to be able to say this in a definitive way. Children are being affected in many other ways. We call them indirectly, through the closure of schools. So many children are losing opportunities for learning, and that has, particularly for the most vulnerable, particularly for the families that has less resources, that may involve other secondary effects, like the parents need to stay home to take care of the children. That may have impact on their ability to perform work, to bring a salary home, etc., etc. Children are also affected by the fear and by the whole anxiety, the collective anxiety that we are, and their parents have a very important role to play. Parents and teachers have a very important role to play to help children cope with this confusion, with the information or lack of information, to help them cope, and then make it into a learning opportunity as well for how to deal with the information, and how to deal with anxiety, how to deal with their own health.
That's great. Yes, of course, and I suppose for parents, their demeanor at home also sets the tone. So it's important they be informed. Talking about information, there's a lot of misinformation out there, a lot of myths. I have friends sending me messages on WhatsApp, which is, sometimes not coming from the right sources, and people are now believing that. A lot of social media rumors, so to speak. So could you tell our viewers, suggest some reliable sources that they should look at and keep, where they can constantly plug in for regular updates? I think a note on making sure that you are looking at the right sources, that is very, very important at this time. So if you could tell them where they should be going to for information.
Indeed, there's a lot of misinformation, a lot of confusing information. Some of it we think it's well-intentioned, people who really think that they may be helping with that, but not always the case. And very often information that may make people be more anxious and have more fear, or even make things that are either unnecessary or directly dangerous for the health. So to prevent that and to get better sources of information, I'm just going to mention three. One of them is the website that we have developed within the unicef.org, or the UNICEF website. In every country in the world, it will have everything we know that actually works, and all the messages on how to talk to your children, and how to describe these things, and what is new that we know about the outbreak, any useful information. And unicef.org, or the UNICEF website in each country. The WHO has also the World Health Organization, so the WHO website in each country, and the global website as well has very good information. And then every government is making an effort, often with our support, to provide the most up-to-date information on how to protect yourselves and your family, and anything that's specific to how the outbreak is being dealt with in your country, you will be able to find that in the government's website. So those are the most.
Those are the most important. So unicef.org, WHO, keep track of those websites for all the latest. We're still getting a lot of questions, so the ones that we haven't been able to get to right now, we will try to answer them in the comments section. And I guess the big takeaway for all of us is to practice basic hygiene and to remember to frequently wash your hands. So thank you so much for all of you who tuned in or who sent in your questions. And thank you so much, Dr. Carlos, for being here and for setting the record straight.
Thank you, Priyanka.